Kelly, and it's good to have you back with us again today.
Thank you
for joining us.
Thank you.
And then we're also glad to have with us Michael Glenn with the Alabama Department of Health in the Northern District. Michael, thank you for being with us again today. So just a quick update from me. As of today, we have 18,775 total cases in Morgan County. That's an increase of 620 cases, or about 3.4% this week. You can take 7 days into 620 and kind of see where we are as far as a daily average. These are reported by the Alabama Department of Health, Department of Public Health, and the moving day 7-day percentage positive rate is 23%. Approximately 43,150 individuals have completed their vaccine series in Morgan County. Now, we talked about the fact that we have right at 123,000 residents. So from there, you can do the math and see by percentage that still about a third of our residents have received a vaccination. And we just want to encourage all residents that are able to go and receive their vaccinations. So Kelly, if you will, we'd love to get an update from the hospital.
Yes, thank you for letting me be here. This morning we have 74 inpatients. That's the same number I reported last week. I hate to tell you, but we've had a lot of deaths since last week. So I don't have the complete number in Morgan County. I don't know if Michael does, but I know we had 5 or 6 in one day. So it has been very depressing at the hospital. For I know on each shift we've had deaths, so that's very depressing for the staff. But 74 inpatients, 3 PUIs, 14 in ICU, 12 of those are on the ventilator. Right now we're holding 10 in our emergency room. 2 of those need ICU beds, 5 of those need medical beds, and 3 of those are psych patients. 16% of our total 74 are vaccinated, 84% are not. Only 2 in ICU. 1 is fully vaccinated and 1 is partially vaccinated, meaning they received 1 of the 2 shots. We have a total of 197 patients in-house. A couple of things that are alarming to me: the monoclonal infusion is awesome as far as helping, but we're beginning to see shortages in that. So we're trying to do at least 40 a day, and that really helps people when you get sick, recover from this illness. But if we begin to see more and more of the shortage across the country, that is alarming to me. We're going to be allotted this week not our full amount that we normally get. So we normally get 200 doses a week. So we've not received confirmation yet that we're going to get all of the other amount that we asked for. So I want to let you know that. We're still doing the vaccines. We're averaging about 74 vaccines a day, which is still pretty low. We'd like to see that increase. I did get someone to tell me, of the patients of the 74, we've had 7 people die since Saturday morning. So that's a lot. I want to give you a breakdown of the 74 and how old they are. So I've got 3 that are in their 90s, 2 that are in their 80s, 15 that are in their 70s, 27 people in their 60s, 8 in their 50s, 9 in their 40s, 9 in their 30s, and 1 in their 20s. So of the 74 hospitalized, you can see they're not a lot of elderly people. Matter of fact, 20 are 70 or greater. So, you know, just want to continue to get the word out that this is, you know, something we need. We need to get more vaccines in people's arms to keep them from dying.
Kelly, thank you. And I remember whenever Dr. Boyle came, he joined us last year, talked to our viewers and talked about how healthcare professionals are trained to deal with death. That's just a natural part of the business, the industry. But they're not trained to deal with it on this magnitude week in and week out for a sustained period of time.
Right.
And that is, whenever he spoke, he said it's taking its toll.
It is.
On the workers, and I would have to believe that it is again.
It is. And these patients, especially the younger, you don't see this much death in young people, you know, and I think that really takes a toll. I think it's hard to lose an elderly person no matter what's wrong with them, But when you see someone in their 30s and 40s who dies just because they didn't get the vaccine, that's when it's so frustrating, as you know, to the staff. And again, they are trying to deal with death, Mayor, but really they're trying to heal people. That's what they want to do. You know, that's their main focus, is we want to do everything we can to get you well and get you out of here. And believe me, they're trying everything they can.
Sure.
You know, all of them, to the point of exhaustion. But that's their mission, and I see that every day. And I think, again, it's just the frustration of, you know, and I think I shared with y'all last week, you know, I know people who've had cancer. I know people who have, you know, other diseases. They would love a vaccine. If we had a vaccine for cancer, do you not think everybody would sign up for that? I would, you know. So it's the same thing. If you could just get this shot, then it would keep you from dying. One other thing I'll tell you, just it's kind of on my heart this morning, just make sure you're right with the Lord, you know, because if you don't get the vaccine and you get this and you die, you know, you need to make sure you're right with the Lord before you end up in our ICU.
Appreciate you sharing
Thanks.
that.
Thanks.
Thank you, Kelly. Michael?
Well, I wish that I had some better news, to be honest with you. Mayor has already given you the positivity rate in the state and the county. We continue to have a lot of community transmission. Our vaccination rates are up a little bit, but our testing demand is up much more than our vaccination rate. Alabama's currently ranks at number 42 in the nation of people having at least their first dose, which that's a positive increase. We were at 50 for a long time. We were at the very bottom, and so we are seeing some improvement in the vaccination rates in Alabama. It's just not going fast enough or to our liking. As Kelly just mentioned, there's been a lot of deaths. I looked at the dashboard this morning. Over the last 7 days, there's been 261 people in the state of Alabama that has the hospitals have reported that have passed away from COVID. In our area, with the Huntsville Hospital System, the Coleman Hospital, Crestwood, and Highlands, there's been 50 of our citizens that have passed away in the last 7 days. That's a lot of people. It's a lot of people. And since April the 1st, since the vaccine has been widely available for people to get, and at the very beginning it was kind of a chore to get in and get it because it was such levels were not where we wanted them to be. But since April the 1st, where it was pretty much readily available, the total deaths from April the 1st until today, 91.5% of those people were unvaccinated. Just to build on what Kelly just said, if we came out today with a vaccine that would give you a 91.5% chance of not dying with cancer, we would have people wrapped around the county wanting to get that vaccine. We have a vaccine right now that is highly effective, it's highly safe. There's been over 300 million people in the country that have gotten this vaccine, and if there were some major safety issues, we would already be found out about it. And so this vaccine is completely safe. Please don't get your medical advice from late night TV shows, from talk shows on the radio. Please ask your healthcare professional. Talk to somebody that's gotten the vaccine before and is doing well with it. If you've known people that have had COVID, not vaccinated, ask them if they would like to go back and get the vaccine now. We've got a lot of, the vaccine is readily available to anybody. You not only now can get it at most pharmacies, at the hospital, at the health department, you can choose which one you want. And so you can research which vaccine that you are most comfortable with and get those. They're all three very highly effective. And so there's no reason for this many people to be dying when we have something that can protect you. I've mentioned that our testing continues to be at a high level. I know the emergency rooms as well are inundated with people seeking testing and stuff. One of the good news this week is that we're going to have a testing center that's going to open up this Wednesday at the Decatur Fire and Police Training Center at 4119 Old Highway 31. That's it's the Decatur Fire and Police Training Center, as I said, but for a lot of people that may not know where that facility is, it's the old Flint Elementary building over there. And so there's going to be a testing group to come out there. I'm going to be here for a few weeks, maybe up to a month, till maybe the testing demand is down. The number for that testing center is 205-927-3438. Let me give that to you again. It's 205-927-3438. And they will begin testing this week on Wednesday. They'll be there from 8 to 5. You don't have to have an appointment, but you can call that number and pre-register, and it just kind of make your visit a little quicker as well. And you can also get that number to get your test results in about 24 to 48 hours. They take insurance, but you don't have to have insurance to go. And so if you're uninsured or you're not comfortable giving out your insurance, please go to that or the health department, and we'll continue to help get those people tested as well. And so I would just leave with this. Please get your vaccinations. As the fall holidays come on, you know, it takes about 5 to 6 weeks from the beginning when you start getting your first vaccine. 3 weeks for Pfizer, 4 weeks for Moderna to get your second vaccine, and then 2 weeks after that before you get full protection. And so if you start today, it's about 5 to 6 weeks before you get full protection from this. With the fall holidays and all of the gatherings that we're going to have coming up soon, please get your vaccine soon so that you'll be fully protected during the holiday season. Last Thanksgiving and Christmas, we got kicked in the teeth after those holidays with all the social gatherings. And so I would just please encourage people that have not been vaccinated to please get your vaccine. Please protect yourself with your vaccines, your masking, social distancing, and hand hygiene. Same things the drums we've been beating for over a year now. And so please do those things so that you can protect not only yourself but your loved ones as well.
So Michael, y'all, the Department of Public Health issues death certificates.
Yes.
And I certainly don't want to put you on the spot here. You won't let me.
Yeah.
But pre-COVID, outside of, I know January and February, those months where people stay inside, the numbers tend to elevate a little bit just for respiratory matters, things of that nature. But in an average month or week, how many, do you know how many?
I don't know that number off the top of my head, but I can get that for the next time that we're here so that we can kind of give maybe something to see
measure
about.
it
Yeah,
against.
absolutely.
Yeah.
I'll look and see if I can find some
You feel
information.
very confident though that the numbers.
Oh, there's no doubt. There's no doubt that it's higher. It's no doubt that it's higher.
Yeah, I would think that it'd have
Yes.
to be, yeah. Very good. All right, well, we have some media partners with us today. We have Mike Wenzel with the Decatur Daily. Mike, it's good to have you with us.
Always glad to be here.
Any questions?
Sure. CDC over last week said that the numbers starting to plateau. Are we seeing that here? You said there were 74.
Yeah, I'm not seeing it plateau yet. The thing that I have seen is the death is what has brought us down. So we were up to 81 was my total, but when you have, 7 people die, that brings the number down. So we're still seeing our emergency rooms and our testing. I think the testing is where you see, if we're going to plateau, you'll start seeing the testing go down, but we're not seeing that yet. I'm praying that hopefully in the next 2 weeks it will.
Yeah, from what we have seen, starting around July the 1st is when the hospitalizations really started shooting up, and it continued. It was a dramatic increase all the way up until about maybe a little over 2 weeks ago, where it kind of leveled off, and we've seen a decline statewide over the last 5 to 7 days. But again, as Kelly mentions, it's not been we've had 261 deaths in the last 7 days.
Yeah.
And so unfortunately, that decline at the hospitalization rate may be those people that are passing away right now. And again, if we take that 91.5% that are unvaccinated that have passed away, that's 200, right at 240, 239, 240 people that ultimately didn't have to pass away from this virus. That's 240 families that are mourning today from somebody that's lost over a vaccine. And so for all of you that just have your heels dug in and saying that I am not going to take this vaccine, I would like for you to look around at those people that you're the closest to and look that if I'm going to be stubborn enough not to take this vaccine, to leave the people here mourning for me for unnecessarily.
Okay. We've had high school and college football cranked up in the last 2 or 3 weeks. Have we seen a spike or decrease? Anything related to the football?
I don't know that we can see that yet. I think we probably need about 2 weeks.
Yeah.
So that may start again. We hope we're at a peak, but we don't know how that will impact us. At least college has been about almost 2 weeks now. So
anytime you have large groups of people that are gathered together, that can't socially distance, that are not wearing masks, that are, as we see in the state, it's around 55, 56% of people that are not vaccinated. If you get into a large group, you can look around and that many people are probably not vaccinated, if not more. And so you need to protect yourself.
So this is Dion with TV 48.
Hospitalization due to COVID decline has last week according to the ADPH data. Is that because of people who were discharged or because of the high number of deaths?
From the statewide numbers, I think Mobile and South Alabama had their peak a little sooner than us,
Yes.
Dion. So I think they hopefully have had their peak, and we are now still in the middle of, kind of that rise, hopefully to see that. But I believe that's where it's from the death and then the amount of people, getting out of the hospital discharged from South Alabama that has caused the whole statewide numbers to go down. That's what I think.
Okay, and we have anyone joining us by phone?
Are we seeing more male or female, and about, you gave the age breakdown, where are we on that, I guess the median age?
Yeah, I thought about that earlier when I had the ages. I wish I had male and female, because Dr. Harris said something the other day that I've seen. In my opinion, and I don't have the numbers with me today, it's more males. I'll go back and get that. But I remember last year in December and January when I walked through the ICU, it was more males in the ICU than females. And I do not think there's any correlation. The virus is not, saying anything to do with gender. It has to do with males not getting the vaccine and maybe being on top of their health care as much as females are. So I believe the females, being sort of the health care, making the decisions in the home, and then the males maybe thinking that they can tough it out or beat this virus or something. But we are seeing more males positive.
And just to build on that just a little bit, as Mayor alluded to at the beginning, as Kelly brought up last week, that pulse oximeter is a very valuable tool. A lot of people sit around and think that, as she said, that we can tough it out. But when your oxygen level in your blood gets down below 90, in the 80s and the 70s, you're in some serious situation, and a lot of times you can't come back from that. And so please keep a checkout on that as well. A very inexpensive gadget that can really help you.
The other thing, Michael, I wanted you might please get up and walk. Some of these patients, they go home and they just want to lay in the bed when they're sick, and then their oxygen level gets low, and then they, like Michael said, they can't recover. So please make sure these patients are getting up and they're mobile as much as they can and walking.
Just from having it, I remember it whenever you're first told that you're positive, it'll play with your head a little bit. I was a smoker. I smoked from the time I was 15 till I was 45, and if I get bronchitis or something like that, it can really sit on me for a while. And I was concerned, if you recall, that it was going to get in my chest.
Yeah.
I was going to end up on a vent, and all these bad things that you think about. But we were determined to do what you're talking about. We stayed active, got up, walked. We did have the pulse ox, and I'm glad you mentioned inexpensive. It was just a couple of bucks.
Yes.
And you put it on your finger, and it'll tell you where you are. So anyway, all good information.
Are we seeing more deaths at home, or you guys been monitoring that? People afraid to go to the hospital, afraid to be put on a ventilator?
I don't know that information, but just from the hospital reports or what I have. But I would imagine when people get short of breath, that they're gasping for breath, they're going to the hospital to get some treatment.
I hope, yeah. I'm not seeing. I don't know that about the deaths at home. But I will say that we are seeing people come in and their oxygen levels really low.
Okay.
So the other thing I'll just mention for you to let people know, we're still, trying our best to run a full service hospital. We are seeing people delay care, delay surgery, delay coming to the hospital when they're sick for other things that they don't need to. If you're having chest pain, you need to come on to the hospital. You don't need to try to tough that out and think, hey, I don't want to go because they have a lot of COVID. We still, at all of our hospitals, we're still functioning, doing everything we possibly can.
All right, well, look, the number of vaccinations in our area are rising, and for that, we are thankful. We want to say we certainly appreciate you taking advantage of these vaccinations. If you want to get vaccinated, you can visit the health department, the Decatur Morgan Vaccine Clinic. We talked about at the Decatur Fire Training Center that those will start up this week. Or you can go to vaccinefinder.org to locate an additional vaccine provider. Until next time, be safe, and as always, be kind. Thank you.
Thank you.